Hey everybody, Dr. Gary Linkov here with City Facial Plastics. As you guys know, I'm double board certified in facial plastic surgery and hair restoration surgery. This here is my hair nurse. This is Gloria. You may remember her from a vlog video that we had earlier. We are doing a reaction today to Jeffree Star. So I heard about this hair transplant that he had and we wanted to do a reaction for you guys. We haven't seen this video before, so let's see how it goes. Also, we are going to be doing the letters game for this video and we're going to up the ante and we're going to give away $100 to one of our amazing subscribers. So please make sure to look for those letters that appear on the bottom right hand corner, then get your codes on Instagram, Dr. Gary NYC, and then we'll pick a winner and announce it during the next video that features this game. Let's get right to it.
Welcome back to my channel. This video has been in the works for a few months. I know a lot of you were like, hi, where are you? This is finally a recap of the last 2 months ever since I got hair transplant surgery. The healing process for this entire surgery is a little bit different than your average like nose job or you get your breasts done. You don't get like instant results after a few months.
That's a good point. I think a lot of our patients come in and they think that it's going to be a pretty instant result.
Yeah,
what do you think?
Definitely not the case. With hair transplant, it's a waiting game. And a lot of our patients have a hard time with that, especially once they have the procedure done, correct? And then
for sure.
Things kind of progress and heal, and then we get to a scary point.
Yeah.
And then they're like, what did I do?
Yes, exactly. I think 3 months is really when people expect there to be some regrowth. And some people experience regrowth at 3 months, but a lot of people don't. So that's when I get those worried phone calls and text messages like, where's the hair? Why isn't it come back? So I tell people 4 to 6 months to start to experience like the hair growing in, and the hair grows in at different points. It's not like all the hair comes in at once, because the hair throughout our scalp, it exists in different parts of the hair cycle, and depends like where it is in the hair cycle for when it returns. You're just going to have a percentage that comes in at say 3 to 4 months, and then more that comes in at 5-6 months, and then sometimes it takes 7-8 months to see the rest of it grow in. And then that growth also happens gradually. It's not like it comes in long. I mean, it comes in short and then it grows from there.
Longer in time.
Since I can remember from like
makeup is really on point.
Yeah, I have to say, I need some lessons.
Yeah, maybe Jeffree can do my eyebrows or something.
Noticed that I had a widow's peak where my hair would come more towards a point and my temples were just kind of like bare of hair.
That's a common pattern,
Absolutely.
I would say.
Yeah, most male that come in, especially younger, will say, I have really deep receded temples. And it's one of the things that, we focus a lot on with our younger patients, and even our older as well.
Yeah, it's like a hallmark sign of androgenic alopecia.
Absolutely.
This darkness all around, that is my new hairline.
There are women that just have a classic M-shaped hairline, and they also have this temporal recession and the widow's peak, and that's just like a normal variant of a hairline for women as well.
I got older and older, I just really didn't like it. My face shape changed. I got my lips done and my teeth, so of course my face appeared fuller, and I've always just really hated my temples. So of course, if you can fix it, why not? If it's for you, then do it for you. If you don't like something about yourself and you're like, you know what, I'm gonna change it, then do it. If you're doing it for other reasons, because you want to please somebody or someone told you you're ugly, girl.
Yeah, I mean, I think we are always talking about the same message on the channel. People should just be doing this for themselves. Now, I've had one person who commented on the channel was saying that, well, if you're just alone on an island, would you ever have plastic surgery? And my response is actually like, well, you don't have the option, because who's going to do it for you? I think that is a good point, that of course there's always that perception by others, and it's not really just only for ourselves, but it really should still be the primary driver of the reasons why someone would get plastic surgery.
Absolutely. I think that most and foremost, you should be happy with yourself, and if that one thing is going to make you happy, then why not?
Long story short, I had hair transplant surgery. What does that mean? Me and the doctor are about to explain it all for you. And then at the end, I'm gonna show you guys a little reveal. So if you wanna see how all of this happened and what the hell I've been talking about for months, then keep on watching. So basically I had from ear to ear, I was cut and about 1 inch of skin was taken and all of those hairs in the back were transplanted.
There are several ways of basically obtaining grafts for a hair transplant.
For what he's explaining, he had a strip of tissue removed from the back of the scalp, which is what we consider the donor area. This particular type of procedure is known as the FUT, but we have a second type of procedure.
Yeah, the FUE. So that's the
right.
individual follicular unit extraction, 1-by-1 removal. Bit more of a modern technique, not always the better technique. There are pros and cons, and we have a video on that.
That's right. Go watch.
Marco's going to flash that one.
Oh, wait.
FUE versus FUT. Yeah, so we cover pros and cons of each method. But one of the major pros of strip procedures is that you can actually get a higher yield of grafts, both per individual session of like in a single day of a hair transplant, but also over a lifetime. What would you say like about how much more hair can you get over a lifetime? Not necessarily numbers, but percentage-wise, what do you think? Strip over FUE?
A good 30%, 25 to 30% more. I mean, really, this is based upon the patient's donor supply, right?
Yeah.
Because we can be very limited. We have to look at a lot of the factors and a lot of the details.
What you're not gonna see in this video is that skin being cut out. It is a little too graphic for YouTube. We definitely will show you the skin in the petri dish and all the follicles, which is really fun if you're into science.
Yeah, I would say FUE is definitely a more gentle way
definitely.
to do things. The recovery is a little easier. It's like not exactly the type of surgery that people think of where you're making big cuts with a knife. There's actually a much finer little instrument that punches each graft out 1-by-1.
It was really crazy. Once they took all the skin from the back, they flipped me back over on my right side and then they numbed my entire forehead. So from like temple to temple here, they did a lot of injections and of course the swelling from the numbing.
We're seeing the markings here of like where the hairline is starting. So it's not just the temples that they're doing, they're really lowering the hairline.
Yeah.
Essentially.
Yeah,
what are
absolutely.
your thoughts here?
No, yeah, it does look like they've lowered the hairline, obviously to give him the sort of female hairline look that he wants, that he's looking for.
Right. In men, I always hesitate to do a significant lowering.
Right.
And the reason is because there's always the risk of progressive recession. And when that happens and you have a super thick area in the front, eventually you run out of grafts to fill further back.
Yeah.
And so we always hesitate. But my assumption is that Jeffree's probably on some stabilizing medications like finasteride.
Absolutely, yeah.
Most likely.
I would think that he would have to be, because otherwise we're going to run into the issue of he's going to continue to lose his hair.
How many grafts do you think it took to fill that area that we're seeing
I'm
here?
guessing 2,800 to
28.
3,000. It's on the bigger side of things.
Yeah.
For sure.
And we'll see how dense they went. Please subscribe. A lot of people are viewing our content, but they're not subscribed. So how are you going to know when the next video comes out? So subscribe, turn on notifications. Don't just subscribe. Notifications on. Thank you, guys.
My entire forehead was completely numb. I was wide awake. I was watching movies actually, so I was just kind of like sitting there on the operating table and there was a big TV in front of me.
That's the thing we always tell patients. It's a long day, but it's not a terribly difficult experience. Usually it's very positive and we talk a lot.
We like to make it fun.
Patients.
Joke around.
Yeah,
you know,
people
we allow
watch
the
their
patient,
phones and they do whatever. So
they listen to music.
We break for lunch.
Right.
So once they were finished outlining,
we're seeing the doctor making the recipient sites, right? So this is where the hairs are going to go. And sometimes people ask, like, well, like when I do the consultation, sometimes I'm right there with Gloria, but when I'm on my own, they'll ask me, like, are you going to do my surgery? And it's really a big team effort. So, like, for example, like I make all the sites just like the doctor's doing here, but then Gloria gets in there with usually Ruel or the other folks who help us out, and they place the grafts into the holes.
Exactly.
New hairline. They showed me a mirror. Obviously I'm swollen. It's like a million little red dots, but I already could see the vision, and I was already like so excited. Like, I know it just happened and there was no healing yet, but I was already so stoked because I could see like the vision of what it was gonna be already, and I was like, oh, thank you God, it worked. They took this diamond-shaped needle that Dr. Ziering actually invented.
Blade I developed is a diamond-shaped blade.
He's gonna go into, I think, like talking about this diamond shaped
something, a specific type of blade holder or needle that he uses for his particular sites.
Yeah, like our holder is pretty much the same. It's the same
standard,
way.
yeah.
And then whether it's a diamond shaped needle or a rectangular type of needle, we actually do custom cut persona blades that are cut to size. Or if you use a needle, which some people do, different sizes of needles. There are actually studies that compare blades to needles and show a very similar results.
Right.
And so there's no major advantage to using what he's using over some of the other methods. Many different clinics would get great results, use all types of different instruments. There's also implanter pens.
Right.
So that's another way to go. But what I always tell people is like, you have to just pick your surgeon and the team,
right?
You know, and then trust that the rest is just done properly.
Right.
The center of it is a diamond shape, and then the two ends are a little like almost like a paper cut on the two sides.
Yeah.
So it enables the graft to gently be placed in the center, and then the blood actually acts as a little bit of a glue, and so it just seals it right in there. So once it's placed, perfect.
Yeah, I think it's wishful
They went
thinking.
to town on the samples, girl. So where everything was missing, they filled in, and then they did, as you can see here, they did it lower and just kind of create a more feminine shape.
Yeah, that's a really big area to fill.
Yeah.
They're going all the way throughout there.
Yeah.
So large territory. I think it's somewhere on the order of 3,000 grafts.
Yeah.
So sizable procedure. They've done some irregularization, which is nice. That creates a more natural type of look.
So as the needle was going through my skin, the numbness, thank God I didn't feel anything, but it was really weird, like the pressure of it. If you've ever had a tooth pulled and felt that, like...
To me, at least, it seems like he's very perpendicular at this point with the way his sites are being made, which might be following
more of his natural hairline towards the back of the temple.
Yeah. I tend to kind of be a little bit flatter in the way I design my sites. General idea is to just follow the natural hairs in the neighborhood and look at the angulation and the direction of growth, and that is something that you kind of figure out with time, and you really are looking constantly at what's around and trying to mimic that, so you get again a more natural result.
Right.
And I will say that the other way to lower the hairline is with the surgical hairline advancement, but the limitation there is that primarily targets the central hairline and not as much the sides and the temple. So then you'd need to then go back like 4 months after that surgery, surgical hairline advancement, and then do a hair transplant. Yeah, especially for the sides and then into the scar. So, I think it made sense for Jeffree to go through with the hair transplant. And because of how low they went overall in the type of hairline that they were trying to achieve for him, I think it made sense to go with the strip for that extra amount or number of grafts that he would have needed.
As the Valium kind of wore off, I got to like go on my phone and I did a little Instagram video talking about it. I had the nurses like
those
in the back of my
nails.
head.
I know, they're nice.
And I was like, is
Bling,
this too much
bling.
for people? And I'm like, it's Jeffree Star. It is what it is, girl. Once all the incisions were done, they basically...
Oh, that's pretty good packing
it's
there.
really good packing.
Yeah, they have a lot of grafts to work with, clearly.
Definitely.
So that's nice work. When you look there, we're not seeing any major areas that
a lot
are
of
missing.
gapping.
Yeah, there's...
It blends into the back really nicely too, which is great.
Yeah, definitely quality work.
all the follicles that they took from the back of the head and they implanted them in all the tiny holes. And it was so cool because each layer of holes had like a different number of hairs.
We can actually see that they have started transplanting the hair follicles, and they're actually using a FORCEP technique, which is what I prefer, what I have done for many, many years, as you guys know. As I can tell, they're placing the single hair grafts right into that first few lines of hairs of sites.
Yeah, and notice how the frontalmost hairline is not perfectly like one line.
Right.
You know, there's some irregularity.
Right.
And that again speaks to like a more natural result.
Yes, and you always want that. You never want a round look or a pointy look or anything like
And
that.
you'll see a lot of that online.
Yes, absolutely.
A lot of that on YouTube
is a
and
giveaway
everywhere.
for a hair transplant.
Yeah. When you're doing the transplant and making the sites, it does feel weird because you want to follow an exact line. But if you look at natural, hairlines, they just aren't that way.
They're
so
not
you have to
perfect.
break it up,
Exactly.
or else the eye picks up on this is too perfect looking.
Exactly.
One person will sliver, so they'll take the strip of tissue that we have and divide it into slivers, like slices of bread. And then what we do is we divide those slivers into the individual flicker units. So there'll be a sliver, and then...
Was this like a similar method to how
Yeah,
you like to
so
sliver?
They use a needle technique. I use a towel clamp to hold my tissue. It gives me more control. I prefer it, and I use my fingers and my hands, obviously. And I like a 15 blade for slivering my tissue. And
they're
then
using what? 11?
they're using 11 to
yeah.
cut, but
Yeah.
I like a 15 for slivering the tissue, and I like a 10 for trimming.
And that's what's going on there.
Once the surgery was done, I was really, really swollen and really exhausted. So Nathan drove me home, and the first night was really difficult for me because you have to sleep at a certain angle. You can't like sleep all the way down, like laying flat, because the blood will like rush to your head and it's gonna affect the surgery I just had. So I had to like sleep at like this angle, which I'm such a side sleeper. I know we're all different, we all sleep different, but like I always sleep on my side. So for me, it was really difficult. Next day, I had to go to the doctor again for a follow-up, and they said everything looked amazing. I was doing exactly what I was supposed to do. And I got the first laser treatment out of 6 to help the healing, and I felt great. The whole front of my new hairline has no pain. It's just the back where they took all the follicles that is a little stingy, but
Which is common
that's why Jesus
with
created Vicodin,
FUT.
so I'm excited.
The strip method definitely leads to more pain
Yeah.
during recovery than FUE. But I have to say, with FUE, I've noticed patients complain of more itching. than the
Yes,
strip.
when everything is healing.
As it's healing,
That's
yeah.
right.
Yeah.
And we do have had some patients that can be very sensitive in the scalp and can actually complain for a few days after an FUE procedure. So it really it varies from patient to patient, but on the overall, most patients that do an FUE don't really have a lot of pain.
Yeah, I agree. And then using this low-level laser light system, I'm not sure how much it really helps for just the 6 sessions, if it really makes a huge difference. There's no great study that I know of where they check those 6 sessions right after like a hair transplant versus a hair transplant result without the laser light. But we know from the low-level laser light literature that overall, over the course of months, if you're on this type of technology for hair restoration, it does help some. So I'm not sure. And it's a similar thing with PRP.
Right.
That we do PRP during the surgery most of the time, and we feel that it helps primarily for preventing shock loss to existing hair.
For healing.
And healing.
Tissues, we kind of do notice and have noticed that a lot of our patients that we do PRP on during the procedure have a little bit of more growth, a little bit faster. This also always varies.
So I'm not sure if the laser light is giving him a whole lot of gain, but I don't think it's hurting either.
Right.
So I think that's fine to offer.
I'm beeping, maybe I'm done. That week I had to go back a few times because they had to help wash my hair for me. Now,
The only thing I'll say about putting anything around the head or someone who's just had a fresh hair transplant is they have to be really
Extra
careful to not bump their head on it, because you can, in the first especially 2 days, like really...
Our worst nightmare is that you
rub the
leave
grafts.
here and you hit your head against something or rub your grafts off with a t-shirt or a jacket or whatnot, and we can help you.
Yeah.
Once you've left the office and we are no longer present, those grafts are gone.
That's true. You won't be able to kind of like preserve them in a jar and bring them here in time. They're not going to survive.
It's so tricky because you're like, okay, all of these follicles were put into my head, and I'm like, oh my god, I have my, you know, my original hair still here, so it's like, how do you wash and clean it? So they actually help do it for you with like a shampoo bowl, like you're at the salon with your neck back, and they help.
Judging by the amount of crusting that I see at the FUT scar area at the incision, I think that they've used dissolvable suture. I prefer to use PROLENE, which is non-dissolvable, less crusting. I think overall, just in the plastics literature, tends to lead to better healing on the skin surface, but does require removal.
Yes.
But though I'm not 100% on what they used here.
Yeah.
They had to also wash all the new follicles and that skin because it was very tender and sore, and like the skin after like days later starts to flake off, and they have to actually help like pull that out so your scalp can breathe and heal properly. On my last day of checkups, I got to thank the doctor, and if you're watching this, Dr. Ziering, I love you, thank you.
Well, those are pretty cool glasses.
Yeah.
Wow, nice shades.
I am healing amazing, you guys, and after that last checkup, it was scary because it's like, okay, now it's my job to heal myself correctly. And the thing is, the surgery takes months and months to fully heal. I did get the surgery in March, and so far I am having crazy results. I feel like a whole new person. And do you guys want to see a sneak peek? So before, I literally had no hair underneath this part, and I'm like, let's just do it. I'm like, let me move this pink out of the way. This is like, come on, old hair. Bam! Doesn't that look crazy?
Cool.
So this is all new hair growth. This was completely like non-existent, and this is only like a month and a half of growth because
that's pretty fast.
I have to say, that is really
skin
fast.
And all the little baby hairs had to shed, and then there was a period where there was like nothing, so it almost looked like how I did before the surgery, and then the hair finally started to grow. So it's been a long process, and now, you know, we're entering July, and I could not be happier. They were like, oh damn, that's growing quicker than normal. So I can see this by like October when it's like fully grown and just, you know, looking a little bit more itself. A few days after the surgery, I called the doctor and I was like, am I allowed to wear a wig?
Yeah, I mean, what are your thoughts on wearing a wig after surgery? He was only like 4 days out.
It's a little early, I would say. I wouldn't want to put something over it and it be hot on top of the grafts. As a healing process, you have to be very careful. We don't really quite know how many days had passed since the surgery, but I think after the sutures are removed, so about 10 to 14 days, it's a safe time to wear a wig.
Yeah, and you have to be careful with where, you know, like if there are extensions or there's so many different types of wigs, like you got to make sure that it's not pulling or putting too much pressure on the recipient area. I mean, that's really critical.
Definitely.
So yeah, and you don't want to be, especially like at 4 days, if this was 4 days, you don't want to be sweating too much because that can affect the grafts. But clearly it was still fine for Jeffree.
It's growing the growth looks good. A month and a half. I wonder if he's had any more transplants since.
Right. It can be an addicting process.
Definitely.
Because what happens is sometimes, you know, the density isn't exactly what you wanted, or sometimes certain areas don't grow in as well, so then you're coming back for more. So it can be a process, but it definitely looks overall like he got that lower hairline.
Yeah, definitely.
And probably exactly what he wanted from what I'm seeing here. Nice job.
Definitely looks nice, yeah.
Yeah, they did a nice job, and it's a great example of where FUT shines. You know, cases like these where you're lowering the hairline by like more than an inch, and you have to fill in the entire temple area, and you just can't go for like a small procedure of like 1,000 or 1,500 grafts.
It's not gonna cut it.
You gotta hit it hard. You gotta hit it hard, and FUE makes it difficult to do that. And
Yeah.
also, if you have such a huge procedure with FUE, then you got to shave a massive area, and it
have
becomes
to do
more
the whole
obvious.
thing, yeah.
You know, in the early period when you're recovering, that you had something done, something just changed. You have all this whole
Right.
area shaved, especially for women, I would say.
Yeah, definitely. I don't want to cut all my hair.
And then we get guys who, you know, have longer hair, and they're okay
Right.
with the strip procedure too.
Mm-hmm.
One thing I'd like to mention, and I have a whole video on basically the dangers or just being super cautious about lowering hairlines in younger men, right?
Yes.
Like under the age of 40 or so. You have to be super careful. So yes, Jeffree had this done, and I don't think you maybe heard the whole story about maybe some medical therapy that he's on, or you know, for stabilization, and but that's always one of those risks, that you use a lot of the grafts to bring the whole hairline lower, but then
Right.
someone's not taking their medical therapy, they're not doing anything.
You're going to be at risk of losing all of your natural hair.
Yeah, and then you have this like great hairline, but then everything
Nothing
behind, then
behind
you're
it.
like missing a crown, and you're missing, you know, all this other hair.
Yeah, then you run into some not so great things. So it's
Yeah.
very important that whoever you choose as your doctor, that they're knowledgeable, they know what they're doing, to have a great team,
Yeah.
and that they come forward and really, you know, give you the proper information about medical treatment, especially if you're a younger patient.
Great. Anything else you want to add, Gloria?
I think that's it. I think this was a great
All right.
video.
We did
Thank
a
you
little
for the
collaboration.
invite.
That's right. Yeah, you'll be seeing more of Gloria soon.
Maybe.
We'll see. We'll see what the comments show. If you guys
Be
liked
nice.
her.
Be nice.
Yeah, right. I've heard everything I need to hear about my look, so leave her alone. You can
Don't
just-
make fun of my hair.
Yeah.
It ain't the best day today.
Yeah. I just came up with this idea actually today, so she didn't.
I didn't get a
have
chance
time
to get ready for the
prepare.
camera. I
Alright.
didn't get a chance to do my
Leave
makeup
her
like
alone.
Jeffree.
All right. Hopefully you guys enjoyed this video on Jeffree Star and his amazing hair transplant. If you did, make sure to check out the card here for Machine Gun Kelly's hair transplant, and we'll see you there. See you guys.
Bye.